It's Thursday, March 14th, 2019. I'm Jer Stays, coming to you from the Detroit Shipping Company studios of Podcast Detroit, where crews outside are getting ready for spring.
That's right, and I'm Sven Gustafson. This is your Daily Detroit, sharing what to know and where to go in Southeast Michigan.
It's National Potato Chip Day. Behind the scenes, Randy had all the better maids earlier today, and I'll be honest, friends, I'm kind of jealous.
Yeah, it's true. You might want to grab yourself a bag of chips for this one. Jared, we don't have potato chips. That would have made for great audio if we were like shoveling potato chips into our pie holes while we were trying to read the stories.
Okay, Mark Maron.
What flavor would you have gone with? I mean, hypothetically.
Hypothetical potato chips?
Had we followed through.
Oh, I'm all about the Ruffles and the sour cream dip, or the French onion dip. The Ruffles and the French onion dip.
You, the guy who never doesn't wear a Detroit shirt, are going to go with
the ruffled Better Maids.
Oh, the ruffle. Okay, thank you. I would go, for the record, I'd go for barbecue or hot barbecue. Former New York City Mayor Michael Bloomberg joined Michigan Governor Gretchen Whitmer in Macomb County on Thursday to announce a $10 million grant to combat the state's opioid crisis. The mayor's Bloomberg Philanthropies chose Michigan as the second state after Pennsylvania for its $50 million initiative to fight opioid addiction and overuse. The initiative aims to work with up to 10 states over the next 3 years through a partnership with organizations including the Centers for Disease Control and Prevention and Johns Hopkins University. Michigan ranks 8th among states for the number of drug overdose deaths, with nearly 2,700 in 2017, up 14% year over year. The state says opioids were responsible for more than 3/4 of those deaths. Nationwide, the CDC says there were more than 47,000 opioid deaths in 2017. In Michigan, the Bloomberg Initiative will support programs that address gaps in treatment and prevention programs. The goal is to find solutions that can be used in other states. Bloomberg and Whitmer appeared together at the East Point Fire and Rescue. The governor called the opioid epidemic, quote, one of the greatest health crises of our lifetime.
Kickoff of that big I75 Reconstruction project in Oakland County has been delayed again to this weekend. The weather is the culprit. It's been unpredictable, and that makes the work hard to do. Here's a little refresher. The $224 million project will reconstruct more than 8 miles of pavement, improve 18 structures, upgrade drainage, build noise walls, and add high-occupancy vehicle lanes to I-75 from Coolidge Highway to 13 Mile Road. You'll also see some southbound ramps closed for the duration of construction season starting at 9 p.m. Friday, March 15th. That's, of course, tomorrow. On Saturday morning, 2 lanes of southbound I-75 traffic will be shifted to the right, also for the rest of the construction season. And shifting to the northbound lanes, starting Monday morning, crews will begin closing the exit ramp at westbound Big Beaver, the right lane at Big Beaver, and the left lane at Coolidge. This episode of Daily Detroit is brought to you by our members on Patreon. Help push Detroit's conversation forward at patreon.com/dailydetroit. Thanks!
Among the road projects Macomb County will see in 2019, crews will repave a decrepit section of 14 Mile Road and widen 23 Mile Road. An eagle-eyed Daily Detroit listener, and we love us, our eagle-eyed Daily Detroit listeners, spotted signage for 14 Mile Road between DeQuinder and Ryan Roads. And Jer, refresh my memory, but I think that's your favorite stretch of pavement in all of Detroit land.
I am so glad this is happening. I've been complaining about this for months.
I barely noticed. Anyway, the project will cost $2.7 million, most of it from federal funding. The rest will be split 3 ways between Warren, Sterling Heights, and Macomb County. That stretch of road took an extra beating from the redirected truck traffic with the closure of I-696, and you can ask Jared all about it offline. Also, 23 Mile Road will be widened to 5 lanes from 2 lanes between North Road and Fairchild. That's an $8 million project paid for by $7 million in federal funds, and the remainder split between Macomb Township and the county. That's not all, though. After the project is complete in the fall, 1 mile increments will be expanded to 5 lanes each year, heading west from North Road to Romeo Plank. There's also 3 resurfacing projects on tap. They are Hayes from 10 to 11 Mile Road, 21 Mile between Shaner and Garfield Road between 14 and 15 Mile Road. Most of the tab will be picked up by the federal government with local cities and county matching dollars. Jer, 23 Mile Road, so they're widening it from 2 to 5 lanes, which I'm not a math wizard, but that just seems like it's going to be a bigger bill next time that the road crumbles and we have to repave it.
One of the things that people don't realize is that often road costs are calculated in lane miles, not miles of road, but miles of lanes in the road. And so they're effectively more than doubling the number of lane miles that will have to be taken care of.
In Macomb County, where, County Executive Mark Hackel is constantly out there complaining about the condition of his roads. Rightly so, but nevertheless, they can't afford to fix what they have.
This leans right back to my fundamental idea, which I'm sure will be not popular. We should not pay for any new roads until we've fixed the ones we have.
The Michigan Department of Health and Human Services and Oakland County Health Division have confirmed a case of travel-related measles in Oakland County. The infected person was visiting from Israel following a stay in New York. That person visited a number of locations in Oak Park and Southfield where officials say people may have been exposed to the virus. We'll have a full list of those places in the show notes on dailydetroit.com. In the days before a vaccine was available, measles infected between 3 and 4 million Americans each year, according to the CDC. Of those, 48,000 a year would be hospitalized, and as many as 500 people died, mostly children. Joining us by phone to talk about the measles and this case in particular is Nicholas Gilpin. He's an infectious disease specialist and the chief medical officer at Beaumont Hospital in Grosse Pointe. Dr. Gilpin, remind us, what is measles and why are we hearing so much about it just generally all over again?
So measles is a very contagious respiratory infection, and it's spread from close contact, person to person, through the air, through coughing, sneezing. And what happens is when someone becomes infected, there's a period of about 2 weeks before symptoms start to show up. And the symptoms typically will be a high fever, cough, runny nose, pink eye. And as the symptoms start to go away, a very characteristic rash will appear that starts on the face and spreads to the body. It's a very red, splotchy rash, and that's sort of the classic measles rash. Mm-hmm. And to your other question, why are we seeing more of this? The answer is pretty simple. We're seeing a lot of measles outbreaks across the country, primarily in populations where vaccine rates have slid. So these are mostly unvaccinated travelers that are coming into the community, and then the virus is propagating through these pockets of the community where there are low vaccination rates.
This case that was reported by Oakland County health officials apparently stems from somebody who was visiting the Detroit area from Israel. How concerned should we be about this here in Detroit?
So the short answer is we should be a little concerned. And the reason for that is that Michigan is one of those states where our vaccine rates are a little bit lower than the national average. We haven't been as diligent about making sure people get vaccinated. So there is a chance that we could see this, develop into more cases. But generally speaking, people who are vaccinated should not really be concerned about this. The vaccine is extremely effective at preventing measles. Now, for those people who may not be vaccinated or may be at risk, there are some things that they need to be on the lookout for. As I said earlier, the symptoms can take a little bit of time to develop. If you can catch it fast enough, there are actually things that people can do to prevent the virus. It still would be effective to get the vaccine if you can get it early enough, because it may not prevent the measles, but it may make the measles less severe than it ordinarily would have been. So there are still other things people can do if they think they've been exposed.
What kind of people? I mean, obviously people who aren't vaccinated, but who else is most at risk for measles?
The easy answer is the very young, the very old. And when I say very young, I'm talking about kids, particularly kids that are younger than 1 year, because typically the measles vaccine is given at age 12 to 15 months. So there's a good period of time before that age when kids are potentially very susceptible to this. The very old, because as we get older, our immune systems naturally are a little bit weaker. And the other population that is of significant risk are people who are immune compromised. Their immune systems are weaker for one reason or another, either because of history of some medical condition like cancer that has weakened their immune system, or some medication that they take that weakens their immune system. Ordinarily, these folks are protected by the herd, right? The idea that if we keep the vaccine rates in a population up to a certain level, those people who can't ordinarily get vaccinated are protected by virtue of that. But as the herd immunity starts to slip, now those people become much more at risk.
Dr. Gilpin, I'm sure you see it all the time. You hear it from patients who are hesitant to be vaccinated because they've read that there's supposedly this link between getting vaccinated for things like the measles and autism. What do you tell those people?
Yeah, that's a really good question. So this is a really insidious misinformation campaign, this whole idea that there's a link between the measles vaccine, or what we call the MMR vaccine, and autism. This paper was published back in the late 90s by a scientist who discovered this potential link. Well, come to find out, the paper was a fraud. The physician that published this information, a lot of this data was actually falsified. The paper was declared, totally misleading, and it's been redacted from the medical literature. But unfortunately, the bell was rung, right? And you can't unring that bell. And so there's still a very significant chunk of the population that believes that there is a link between the MMR vaccine and autism. And that is largely to do with the fact that most autism cases are discovered at around the time when children would be getting the vaccine. So there's sort of a temporal relationship there, but it's not a causal relationship. So I remind people of that. And I also remind people that there have been countless studies that have tried to verify this link between the vaccine and autism. And no other studies have ever been able to replicate these results. The bottom line is that there is no link between the MMR vaccine and autism, plain and simple.
Nicholas Gilpin is Chief Medical Officer at Beaumont Hospital in Grosse Pointe and an infectious disease specialist. Dr. Gilpin, thanks so much for coming on and sharing your expertise with us.
Thank you for having me.
And by the way, the measles, mumps, and rubella vaccine, otherwise known as MMR, is readily available and administered in 2 doses. Oakland County Health Division says that it costs $71 per dose, but is free for kids of families who don't have the means to pay for it. We'll have a link of all the locations where you can get vaccinated in the show notes.
There's more news about the embattled mayor of Taylor, Rick Sollars, and the FBI raid of City Hall last month. The Detroit News reports that the FBI is investigating Sollars for racketeering, bribery, wire fraud, and money laundering. It also says prosecutors have filed liens against Sollars' home and cottage south of Jackson as potential forfeiture upon conviction. The properties are valued at around $600,000. Sollars doesn't yet face any charges and has professed his innocence. The News got a hold of sealed court records that tie the Taylor mayor to a larger public corruption scandal centered in Macomb County and involving former towing tycoon Gasper Fiore, who was serving a 21-month sentence in prison. There's more in the full story, which we'll link to on dailydetroit.com.
Unidentified substances have been found in Bear Creek in Macomb County. That's near the Detroit Arsenal in Warren, near the intersection of 11 Mile and Mound. The Macomb County Public Works Office has deployed absorbent booms to contain 2 substances. One is a yellowish-looking ick in the drain. The second had a sheen to it, suggesting a petroleum-based product. Officials hadn't figured out what exactly the substances were as of this recording. Bear Creek is a partially enclosed drain that carries stormwater and snowmelt from the southeast corner of Oakland County through much of Warren before connecting with the Red Run and eventually Lake St. Clair.
This is a good reminder that nature cares not for your fancy county lines and man-made drawings.
Yeah, and there's probably lots of icky stuff that ends up in those covered drains that
we don't even see
snake through our region.
Yeah, because we don't even see those. I think the only reason this got noticed was this was an open portion of this drain.
Yeah, yuck.
Daily Detroit is brought to you in part by Milo Digital. Milo Digital is a full-service digital marketing agency that engineers quality results through data and innovative strategies. Learn more at milodetroit.com. Here's a good pick-me-up story. U.S. Customs officials say they seized 10 pounds of methamphetamine tablets from a car at the Blue Water Bridge in Port Huron that was being transported from Montreal to Calgary. None of the 3 people in the 2019 Volkswagen Jetta were able to provide proof of citizenship, so authorities searched the car and discovered the drugs. The driver told authorities that he had agreed to transport something to Calgary to work off his $2,000 gambling debt. He then picked up 2 passengers in Toronto, and a mapping app on his iPhone directed them to the Blue Water Bridge on the U.S.-Canada border.
So, Jer, I mean, I looked at a map of Canada and tried to figure out, does it make any sense to come through Michigan if you're trying to go from Montreal to Calgary, which is out in the western part of Canada.
Which would make sense, as if, say, you're going to New York. I know people who cut through Canada go through Toronto to drive there faster.
But in this case, it makes no sense. So, like, these were not intelligent criminals, apparently. In pizza news, everybody's favorite, Buddy's is continuing to expand. They plan to open up their 16th location in Michigan this June. It'll be on the site of a former Ruby Tuesdays on Beck Road in Plymouth Township.
Before we leave you today, a recent home listing in suburban Ferndale is making some eyes pop. $450,000, creeping on the $500,000 range for a modern home made of shipping containers.
That's right, Jared. That's going to attract a lot of attention in a community where the median asking price right now, according to Realtor.com, is $185,000. So quite the jump.
Before we get talking about this, here are the basic details. It's at 3271 Inman Street, and that's on the north side of Ferndale, just south of I-696 and east of those railroad tracks. It's 3 bedrooms, 2.5 baths, about 1,800 square feet, open floor plan, and of course, fancy fixtures at that price. But the snark has already fired up online. But man, if it sells for near that, this could be an inflection point for the community and, frankly, your community. You live out that way.
Yeah, it's a different neighborhood than where I live in Ferndale. We should mention also this is a shipping container home.
Right.
It's a new build, key detail. So definitely, I think, trying to capitalize on kind of the novelty of that. It's interesting. I was kind of just looking at the map on Zillow just to see what homes in Ferndale are listed for. And you can find some homes that will, also kind of pop your eyes. There's another new build right off Woodward on the west side of Woodward, other side of Woodward, that's listing just underneath $600,000 right now. I think this one's kind of novel because the neighborhood it's in, really kind of modest working class homes. I would say they're probably like post-war construction or just before the war, the aluminum siding and everything. So it's definitely going to stand out in that neighborhood. That's not the kind of neighborhood where you would see homes priced at this. I would also just add that I could list my house for $450,000. It's never going to sell for that, but I could list it. So we'll see what the final sale price is, but we'll keep on top of that.
See, where I got confused was I always thought shipping container homes were supposed to be some sort of affordable option or something like that. But I'm starting to see it that this place in Ferndale, some older places in Corktown, that they're not, that they're like, I guess it's a premium to live in them now around here. I just don't understand that one.
It's the end of the week, so some thank yous are in order. We're going to shoot thanks to Cheyenne Nocerini, Randy Walker, Nuri Gojai, our spirits advisor, Bob and Dave at Podcast Detroit, and of course, to you, our listeners. You're the ones we do all this stuff for, and we appreciate every minute that you share with us. With that, I'm Sven Gustafson.
And I'm Jer Stays. Take care of each other, and we'll see you around Detroit.
You're listening to the Podcast Detroit Network. Visit www.podcastdetroit.com for more information.